So for the sake of time, I'm going to go ahead and get started. Hello, everyone. Before we actually get started today, I want to acknowledge with respect the Indigenous peoples and communities whose historical relationships with the land continue to this day and on whose traditional territories all of our work takes place. So my name is Autumn Sykes. I am the project coordinator with the Canadian Coalition for Green Healthcare. And on behalf of the coalition and our project collaborators, I would like to welcome you to today's webinar, Opportunities for Battery-Powered Micromobility in Healthcare. Throughout the webinar, please use the chat function for any technical issues you may be experiencing. Use the Q&A function for any questions you have regarding the presentation, and our panelists will be answering questions at the end of our webinar today. We are also recording this webinar, which will be sent to all registrants and will be available on our website and YouTube channel at a later time. So I just want to give everyone a quick rundown of why we're here today. So as some of you may know, in 2023, so for the past year, the coalition has been doing a zero emission vehicle awareness initiative with funding from Natural Resources Canada. And so this project is focused on advancing awareness, knowledge, and confidence in battery-powered micromobility devices. So e-bikes, e-scooters, things like that. And we're really just trying to bring them into the healthcare community and encouraging healthcare workers to use them on their commutes, as well as looking for opportunities for these devices to be integrated into healthcare fleets. There is a goal now to diversify fleets across Canada, and not only within healthcare, but other opportunities as well. And so for this project, in light of that, we conducted 3 case studies, but we're only going to be looking at 2 today. And so we had the Yukon Home Care Program and Joel Drennan, who I'm going to introduce to present first. He is a registered nurse with the Yukon Home Care Program, and I'm very excited for you all to hear about their battery-powered micromobility initiative. Take it away, Joel.
Hello, everyone. Thank you, Autumn. So my name is Joel. I'm a registered nurse at Whitehorse, Yukon. I'm just going to pull up my slides here. Just one moment. Sorry, just a little technical difficulty here. Okay, so hopefully everyone can see that. Land acknowledgement where I'm from. So I'm coming from Whitehorse, Yukon, traditional territory and land of the Kwanlin First Nation and Tohon Quechan Council. Really happy to be here and really happy to work with the Canadian Coalition for Green Healthcare to kind of put together all this information into a case study. So I'm really excited to share it with you today. So yeah, we'll get started. So a little bit of information about where we're coming from. So we are up here in this little purple area, the Yukon Territory. So this is kind of about 24 hours north west of Calgary, Alberta, and we're just about 2 hours right beside Skagway, Alaska. So we're pretty close to the coast where I am in Whitehorse. And we have 14 First Nations in the Yukon Territory with 8 different language groups. And we have a smaller population, around 45,000 in the entire territory. So if you can see this kind of blowed up version of the Yukon, you can kind of see where we are in Whitehorse, and our Yukon Home Care Program is kind of one program for the territory. So we do spread out all the way up here, kind of the Beaufort Delta Sea up in Old Crow is one of our most northern communities. And then Dawson City, you might have heard of that place. And just a bunch of wonderful communities throughout the Yukon. So the bikes are just indicating of where we now have bikes, which is these are the e-bikes that we're going to talk about today. So um, I'm just gonna kind of run through what we did and how we kind of put forward this proposal in the first place. So it was kind of halfway through COVID, we were feeling like we maybe a little bit of burnout in the healthcare system, and we're trying to figure out different ways to engage staff and promote mental health and physical health at the time. So around February 2022, we kind of really pushed for it and brought all the information together and pushed it forward for our rollout date in April of 2022. So we our initial steps was research with any project. We try to pull in as much data that either has already been collected or other people have done across Canada. So one of our really great data sources was the pedal poll through Velo Canada Bikes. So they did a poll in Whitehorse specifically, so it was really applicable to our population here. But it also was in other, cities across Canada, big cities in Toronto, Vancouver, Whitehorse, Ottawa. So basically, what it was is they did a poll of who was actually biking in those cities, and then how many people were biking, and the gender parity for males and females of who was biking. So there's way more detail to it than that, but that's kind of what we helped to use to help with advocacy here. I work in home care, which is about 90% women, and Whitehorse, as you can see on this little map here, or this chart, Whitehorse had one of the highest parity, highest male female biking in the cities across Canada. So we knew that both females and males did like biking here, and then we had to figure out like if healthcare workers in home care actually wanted to do it. So we did a big rollout with Bike to Work week 1 year. We kind of gauged staff interest in kind of just being engaged in Bike to Work week. It turned out even the people that weren't biking to work that week loved the kind of competition and the support for people that were biking. There was little prizes and lots of pictures about people biking with their families here. So that was kind of noting that there was actually interest within home care. And then at that point, we looked at government goals. So we looked at, we work really closely with the government here, just because we don't operate as a health authority. So a lot of our initiatives are kind of combined, which is different than other areas sometimes. But they put out, the Yukon government put out in 2020 our Clean Future document, which is basically trying to diversify fleet vehicles. We use a lot of fleet vehicles in the Yukon, and they're trying to just get different forms of transport, either public transit, walking, biking, anything. So we knew that there was a political interest. We knew that there was the local kind of citizen interest, and that the healthcare workers wanted to do it. So then we kind of proceeded at that point to seeing how it could roll out. So yeah, so at this was kind of next steps for us. So in February 2020, this was a time in the Yukon where spring is coming, so it's an exciting time of year. People are kind of more interested in getting outside, getting active, getting on bikes. So it was a good time to kind of roll this out. And it was the end of our fiscal year. So we were able to kind of look at budgets, and we had to purchase, the bike or start this program before April to be within fiscal. So it was all kind of coming together at the same time. And then we just had to run through the logistics. So we ran it through our safety team. They were really excited about it. So they kind of helped us build a safe work practice document. And then their only request was we had to provide education for each bike, how it works, and make sure staff are comfortable on those bikes before they're just using them. So we do a whole training program here prior to anyone using the bike. And then we kind of did a bit of a promotion of the bikes. So we had our directors and nurses and OTs, physios, and even um, our ADM. So our ADMs came out, and bigger management just coming out and riding the bike. We took pictures of them. We kind of had staff involved, and we kind of rolled it out that way, just so there was support from all levels that people could see that, and then there was a bit more engagement at that point as well. So these are the steps that we took. This little chart over here on the right is kind of just a bit of a budgetary piece that we did. So there was a lot of kind of local incentives. So the government was putting out incentives to buy e-bikes in the Yukon. So they could, so that's, we kind of pulled on that as well. So like a typical e-bike, or the bike that we were looking at, was around $6,000. So we got, about $2,000 in incentives. And then we had a health budget that ends at the end of fiscal. So that's kind of addition to our home care budget. And we pulled from that as well. And then we did a little bit out of our home care budget for the bike, which was, it just helped with that incentive to kind of get it rolling and pull in all the partners in the process. So I think with working with governments in general, risk is always a piece that we have to discuss. Oh, sorry, I did that. So yeah, I think we just chatted about that, but it was really bringing in the theory and the education, making sure all the safety gears in place, and then kind of making sure we have the policy in place to kind of support staff to bike. And the really key thing was to support staff's mental health and physical health. So, they could take the bikes out on lunch breaks as a social piece, but they can also use it to do home visits for their kind of days, for OTs, PTs, nursing, different managers and home support workers at home care. They could all use the bikes. So yeah, so what we did, oops, sorry. Can't really see the top of my slide on this one for some reason. Sorry. Just gonna share that again. Okay, so sorry about that. So at this point, we were able to kind of do the rollout on April 2022, and we've had it in place for the past 2 years. So kind of some of the exciting facts about how we rolled it out is we've got about 845 kilometers by e-bike instead of our fleet cars over the last 2 years. So we're able to save about 210 kilograms of CO2 emissions. And we were able to increase our fleet of e-bikes from 1 to 4 bikes over the last 2 years. So we're hopefully trying to span across the Yukon now for e-bikes and help other kind of partners within governments and healthcare agencies to kind of get their e-bikes programs started here as well. And I think healthcare professionals are able to kind of, arrive by bike sometimes. So they're able to lead by example and kind of promote those health benefits of doing that. And I think it's really helped with kind of these pieces down here around employee retention, the mental health piece, and just supporting our staff to be engaged and healthy at their work as well. So yeah, so that's kind of how we did it. And I hope other people are able to do it as well across Canada. Thank you.
Thank you so much, Joel. We really appreciate you being here today and presenting. And now I'm going to introduce Katie Booth, from a recreational therapist at Hillside Pines Homes for Special Care, here to present on their site Cycling Without Age initiative. Thank you, Katie, for being here, and take it away.
Okay, thanks, Autumn. So as Autumn said, my name is Katie. I am the recreation therapist here at Hillside Pines. Hillside Pines is located on the south shore of Nova Scotia in Bridgewater. So how our program started at our home here. Our trishaws were first seen by our administrator, Marisa, at a regional conference in 2019. From there, the program idea was translated into a funding request to the provincial government's Department of Health and Wellness. For that grant, we had requested $60,000, which of course would cover the cost of 2 trishaws, any additional special equipment we might need, insurance, and wages for a care partner to kind of help us get our program off the ground. In 2020, we received those 2 trishaws. And then in June of 2022, we officially launched our Cycling Without Age program at our home. So the goals for our program here at our home is we wanted our elders to experience their community and nature up close on a bicycle. We wanted to give our elders the opportunity to tell their story in the environment where they have lived their lives. We wanted to give them the chance to feel the wind in their hair. And we also wanted to reduce what is known as the 3 plagues in long-term care. So loneliness, helplessness, and boredom. So when we were looking for trishaws, the 2 trishaws that fit the needs of our elders best were from Van Ram. The first bike that we purchased was the Chat. So it's a bench, sorry about that. So it's a bench style bike, able to seat 2 passengers. And our other bike is called the Velo Plus 3, which is designed to hold a wheelchair. So both of our trishaws have the traditional features of a bicycle, but of course they do have the electric pedal assist, 3 different settings. They both have a seat belt, and our Chat bike, so the bench seat, does have a canopy that provides shade whether you're biking or if you're pulled over stopped somewhere. And the canopy, I'm not sure if you can see in the farthest right picture, just behind the bench, there are 2 little poles, and those poles is what would support the canopy. So our elders who want to participate in our program are assessed by a regulated life enrichment care partner. So either myself and our OTA and PTA, our occupational therapist, or our physiotherapist. Our elders are reassessed when there is a change in their mobility. And we are a small home. We have 50 elders that live here, and 50% of our elders participate in our program here. So our pilots, which are known as our bicycle drivers, is open to any care partners, family members, volunteers. The process to become a pilot is to complete the application and the waiver. There is in-person theory training that one of the regulated life enrichment team care partners facilitate. And in that training, we would go over our pilot handbook, our trishaw manuals, the rules of the road, policies and procedures, emergency plan, all those things that are theory-based. And then those same care partners would do a road evaluation. So making sure that our pilots know how to safely load elders onto both our bikes, how to be safe on the road, take them on a couple of our different routes that we have throughout town, and how to safely unload our elders on both bikes. For the person theory. This is about a 45-minute training, and the road evaluation really depends on the pilot's comfortability on the bike. We've seen some pilots who jump on the bike and are able to feel comfortable and show all those skills within 20 minutes. And other pilots, it might take going out on the bike three or four times before they feel they're comfortable with them. So our rides, the length of our rides really depends on the elders, of course. So we have done rides as short as 15 minutes and as long as 3 hours. We have gone on various routes throughout our community. And one of the things getting our program up and running was the designated care partner actually took our bikes throughout town and made routes for us that were accessible by bike. In Bridgewater, we are lucky that we have a great trail system here, but we also have a lot of hills. So by going out and seeing the trails or the routes in our neighborhood that we could go on was extremely important before we got out there with our elders. So the next couple of slides are a couple of our favorite spots that we bike to often. So the first is the Bull Run Trail. Centennial Trail. We have our duck pond that we go and feed our duck. Memorial Park. Kingsman Field, which is a field where there could be a rugby practice, soccer practice, lacrosse practice while we're cruising on by. Tasty Freeze, of course, for ice cream. Tim Hortons drive-through. Our local neighborhood. Public library. Lunenburg County Lifestyle Center. To go see the hockey games, figure skaters, and that's where our library is as well. Our home is located right across from Exhibition Grounds, which has special events throughout the year. So they had an antique car show here for Father's Day. Of course, we have our South Shore exhibition. So with that comes a parade. So this was our 2022 parade. And then 2023, we spent the week at the exhibition. And of course, we had the parade again this year. And our entry was our van and our two trishaws, and we actually won first for the best decorated vehicle. Our elders put a lot of effort into the decorating, which was great to see. We were in the first ever Lunenburg County Pride Parade this past summer. Many shopping trips to Giant Tiger and our local mall. And here are some quotes from our elders. I love it. I would go again anytime. It makes me feel young again, and I like the wind in my face. It's nice to get out and get some fresh air. I like everything about the bikes. Bikes make me feel alive. It reminds me of my motorcycle days. So one of the cool features of the Van Ram bikes is they actually have a mobile app that we can connect to our phone so that we can get the number of rides and mileage that we have done. So what we did for the last 2 years is just take the months from June to August to get those numbers. So in 2022, we did 29 rides. And then this year, between June and August, we did 49 rides. I will say our bikes are out as soon as the weather's nice. So typically around the middle of May, Our bikes come out, we're on the road, and we'll ride again until the weather drops cold. So usually the middle to end of October. So our mileage, again, looking at those 2 months for both years. In 2022, we did 380 kilometers. And then in 2023, we did 700 kilometers. For our total 2023 season, we just did a little bit shy of 1,400 kilometers, which is incredible. I will say our program is so loved by our elders that this season, now that we've got it up and running, we will come in and every day, it's nice that we will have a wait list of elders who have asked to go for rides. So it's amazing, which I think is what helped us get to that such high kilometer number this year. So of course we needed a way to measure how satisfied our elders were with this program. So in 2022, again, between June and August, we had asked our elders to complete a pre and post ride satisfaction scale. So this scale had asked questions about how our elders feel physically, emotionally, their quality of life, and how satisfied they are with the program. It was no surprise to us once our elders were out on these bikes that post ride, their physical health, emotional health, and quality of life was rated higher than it was before the ride, which is pretty incredible that there was an overall improvement of their well-being just in this one activity. And you can see that on the elders' face from the moment they get their name on the wait list to get on the bike, having their ride, and even when they get back, they're still beaming. So sharing of our program has gained a lot of traction, whether it's through our Facebook page or just us driving around the community or going to different events like the exhibition. We have shared our program already with 2 local long-term care homes, Queens Manor and Tybee Terrace. And we had a visit from our premier, Tim Houston, and MLA Becky Duran this summer as well. So some goals for the future of our program is we want to be able to recruit more pilots. We do want to involve more family and friends to join our ride as companions. We want to explore new routes, maybe outside of Bridgewater, and secure transportation so that we are able to explore those new routes, as well as help us get our bikes to and from maintenance appointments, or to help us when we do have a breakdown. Autumn, maybe I'll pass it back over to you to monitor the question and answer section.
Sorry, I have some issues with my laptop. So thank you so much, Katie. Really appreciate you joining us today and sharing that. I think it's important to note how happy all of the elders looked in all of those photos, and it's just fantastic to see. So I'm now going to invite Jane, who the Executive Director of Cycling Without Age Canada, to tell us a little bit more about Cycling Without Age and share how other organizations can get involved.
Thank you, Autumn. It is truly an honor to be included in today's discussion as we delve into the topics of micromobility and the significant impact it can have on how we can age in Canada. I'm speaking from the territorial lands of Treaty 7, which is also home to the Métis Nation District 5 and 6. Our organization, Cycling Without Age, has witnessed countless times on how the simple act of taking someone for a bike ride can be a powerful catalyst for change in our communities and in the health of our seniors. The federal, provincial, and territorial forums of ministers responsible for seniors define social isolation as a low quantity and quality of connectedness with others. It goes on to talk about the absence of mutual rewarding relationships. In Katie's presentation, we saw a lot about the passengers, talked a lot about passengers. I'm going to ask you a couple questions to reflect on how you felt in your interactions with seniors. So I want you to think about a visit that you've recently had with a senior, be it a grandparent, an aging parent, maybe an older neighbor. How did you feel about going to that visit? What did you do during that visit? How many times did you smile during that visit? And how many times did you laugh? You're like most, it was focused on health issues, completing tasks, and listening with an open heart. Today, we're going to talk about how we can change that picture. Cycling without age, as you know from Katie's presentation, can have a transformative impact on how we integrate our seniors in our community and the connectedness that can be mutually beneficial for both parties. Look at this image. Now I want you to look at this image and I want you to think about the person here who's volunteering. How do you think they felt about going to this visit? How many times do you think they smiled during this visit? And how many times do you think they laughed? And if the volunteer enjoyed it this much, just imagine how much more our passengers enjoyed this social interaction that came from both sides. Our founder, Ole Calzo, was inspired to start Cycling Without Age when he was commuting to work. He noticed how many elderly people were isolated and lacked the opportunity to enjoy the simple pleasures of cycling. The concept of cycling without age is simple yet powerful. He introduced the first trishaw in 2012, and the idea quickly gained momentum. One of my favorite stories is he wrote a grant application for one trishaw for the city of Copenhagen. And Dorothy Pedersen read the application and thought it was such a fantastic idea that she approved the funding for 5 trishaws. And so the Cycling Without Age movement began. In making our commitments to the UN Sustainable Development Goals, number 3, 10, and 11 offer inspiration. Regular physical activity has been proven to have a number of health benefits, from enhancing cardiovascular fitness, joint mobility and flexibility, muscular strength and endurance, reduce stress, improving overall mental health. And what we find in addition to those for our seniors is that it also can increase energy levels, have a greater sense of independence. We start to see, and especially those that have been touched with dementia, better eating habits, sounder sleeps, and fewer outbursts. Our program not only contributes to the health of the individuals, but also to foster and enhance community and social connections across many different generations and promote a sense of community and connectedness that are critical elements to building resilient and sustainable societies. So let's take a look at micromobility and what these changes are making possible for us. So take a look at these images. I have one from Denmark and one from Canada. And I'd like you to type into the chat the answer to the question, how long do you think it will be before Canadians are recovering from knee surgery like the second image? I am proud to tell you that for the past 8 years, they have been doing this in Canada at the hospital in Banff National Park. And indeed, the picture on the left is actually a physio clinic in Copenhagen. One of the things I love about travel is to gain inspiration from others. And again, I have 2 images, one from the Netherlands, one from Canada. And I'd like you to type into chat which parking lot, which one of the hospital parking lots you think is in the Netherlands. And my Calgarian friends, I'm sure, will recognize the building. But yes, 18 years ago, the Children's Hospital was built to include a covered and safe parking storage for all their staff. And as you can see, my trishaw would fit nicely into those big gated doors there. We have a lot of great cycling infrastructure going on in Canada right now. There's been a lot of work done. There's a lot of work coming that really helps support our program. And we know this because, as you can see from a Canadian perspective, we are operating from coast to coast to coast. We started in St. John, New Brunswick, and in 2015, and we've grown ever since. In fact, in the summer of 2020, when the world was shut down, we had at least 10 very quiet when they run care homes were still taking our bikes out and allowing one passenger at a time to go out. And what they did was they installed a plexiglass between the passenger and the pilot. And so it was one of the safest ways they could actually get us seniors out and keep them away from other people. With all the volunteers unable to enter the building, it was also a well-deserved mental break for the care workers as they became the cyclists. You may wonder why I've got the two photos, and I promise I'm not going to ask any more questions or make you do any more work. But I did want to remember and touch on a couple points. And one which is interesting, kind of a side benefit to our program is that a number of our volunteers are between the age of 55 and 70. And so it's a wonderful opportunity to bring meaning and purpose to those transitioning into retirement. And we find a lot of them have maybe given up their bikes for various reasons, life got busy and whatnot, are not only are they volunteering for Cycling Without Age, but they're actually starting to cycle more on their own personal time as well. And second point is that it doesn't matter where I am, and I'm lucky I get to do demo days all across Canada. I have at least one senior that always jumps on the back and takes me for a ride. It's really fantastic because of the e-bike component and the stability of the two front wheels. It's very safe and very secure for seniors who haven't cycled in a long time to hop on and go for a ride. I'm often asked who should run our program, and the truth is anyone who has a passion and a love for hearing stories and delivering pure joy. So right now we have about 50% of our chapters are run by care homes themselves, and they will either include they will either have volunteers come in and ride, or they'll actually have their own healthcare workers take their residents out. We have 38 roughly community groups, and these community groups could either be an established group that already exists or a newly formed team. Sometimes we see seniors groups, we see different community centers start programs. And lastly, we have about 12% are run by First Nations or towns, and they're often run through family services or age-friendly communities. And one of my favorite ones is run through a library. And at the library, it's stored in a shed just outside, and you go up and you can check the bike in and out to take your loved one out, just like you would take a book, which is really fantastic. So if you want to join the fun, you'll be contacted if you sign up and become an affiliate with our organization. You'll be contacted by one of our ambassadors to help guide you. And as you move through that process and get closer to purchasing a bike, you'll receive a jumpstart kit with all the materials you need to run the program. And there's no fee to join our organization. And we have a really strong peer-to-peer network to help support you, both launching your chapter as well as ongoing inspiration. This program does, however, come with a big warning. I have to admit, it is contagious. It's contagious for the people that run the program. It's contagious for the people that are serviced in our program. Once our seniors start to feel welcome in their community, they'll want to be out more. We've seen where, people didn't leave the care home, and then they started coming out into, the front foyer. Then they started coming out to the front of the building, and then they started walking around the blocks. So what we're seeing is by feeling more comfortable in their environment and knowing a little bit more about where they are. Often, seniors are feeling a little disoriented in their own homes, and then they get moved into a brand new neighborhood. So they're feeling very scared. They don't know that there's a coffee shop down the street. They don't know there's a river around the corner. So the more familiar they get with the neighborhood, the further they want to explore, and the more they want to pedal themselves. So we're seeing a real trend that is moving our seniors from the seats of our trishaw into some of the other bikes you'll see here, be it the side-by-side where they still have somebody out and cycling with them, which is a little bit more on the stronger adaptive side, through to two-wheel bikes, three-wheel bikes, and electric scooters. So, a funny little story is, and one I'm quite proud of, is the woman here in the purple with on the side-by-side and the blue bike is my mom. so very near and dear to my heart. She gave up biking almost 20 years ago and kept telling me year after year how much she wanted to cycle again. Hence my involvement in cycling without age. However, really hated the dry shop. Every time she was in it, she's like, I'm not that old. I can still pedal. However, she wasn't able to, and I worked really hard to find a bike that she could. And 2 years ago, she was in hip surgery for a hip replacement, and they broke her hip. And quite a remarkable recovery. She hopped for 6 weeks. And then one day we were sitting there in physio, and she was just coming to the end of her physio. And I was like, oh God, what's next? Like, how do we keep her moving? How do we keep her going? And she has the love of outdoors like I do. And I saw her on a recumbent stationary bike in the physio clinic. And I said, God, I gotta find something like that for her. But she's also been touched with dementia, so going out on her own can be quite dangerous. So I found this bike, super excited. And we purchased it for her. And I'm proud to say she's been riding it ever since. And she rides right through all weather. She goes out in the rain, she goes out in the sunshine, and her caregiver even brings snow pants. And so the two of them go out in the winter as well. So really, really a great way to get people cycling. So I brought the story forward. I was telling one of the care homes that I work with. And so they've purchased 3 of them. So we're doing a pilot project. And they've also purchased 2-wheel bikes, 3-wheel bikes, and already have a number of their residents with electric scooters. They started the Cycling Without Age program a number of years ago. And like I said, you know, the more people wanted to get out, the more they wanted to get out. They wanted to be able to let their residents get out and go further. So it's been a hugely successful project. We didn't even have the bikes finished, and seniors were coming out and lining up ready to take it for rides. They did our testing. I'm not sure that was necessarily a good idea, but we did a quick demo, and then boom, they were on the bikes. But yeah, it's been a huge success and a lot of fun. We're seeing a big movement towards senior cycling again. My last and final story is about my friend Tilly and Ed. Oh my God, I love them to death. They live in the same facility, but not in the same section, unfortunately. Ed has quite advanced dementia and struggles to recognize people and events in his life. So I had the honor of taking the 2 of them for a ride in one of my demo days. And we were 2 blocks away from the care home, and Ed reached over and grabbed Tilly's hand and said, remember all the trips we made across Canada? He went on sharing affection with his wife and telling me stories for the next 45 minutes. Thank you for your time today, and I'll turn it back to you, Autumn.
Oh, such a beautiful story. And you know what? That's the second time I've heard that, and it still makes me tear up. I think it's so beautiful and so important to have connection to community and connection to each other. So the fact that these programs are bringing that into the lives of people that may have lost that, I think is so special and so important. So thank you, Jane. I really appreciate you being here to present, and same to Katie and Joel. So let's get into a little bit of Q&A. Katie and Joel, if you want to rejoin here, appreciate it. Awesome. Okay, so there's a couple direct questions, and then I think some for the group as well. So I'm going to start all the way back to our first presenter, Joel. Michael, who he actually works with the Canadian Electric Bike Association. Hi, Michael, by the way, shout out. He's asking you, Joel, what brand of e-bikes do you guys use?
So we do the initial e-bike that we use because our incentives here are related to size of bike. So it's a e-cargo bike that we qualified for. It's the Momentum bikes. So yeah, I can bring up the specifics. That's the one that we purchased as a home care program, and then our fleet program also just started buying bikes. So those bikes are they can be a number of different bikes that aren't necessarily cargo. Specifics for those names, I would like to send those out separately. I don't have the exact name, but the Momentum is the one we got.
Awesome. And Kelly was wondering if you worked with vendors or Velo Canada for more sheltered type of e-bikes, or rather Velo mobiles to have more room for storage and ease of balancing. Because I guess you cited that's one of the issues you have is the lack of storage and stuff.
Yeah. We didn't we looked at local vendors. So we worked with our two bike shops in town to kind of figure out what would be best. The way that we chose the bikes were the bikes that would fit everyone of different sizes, to kind of be able to get on the bikes easily and get off the bikes easily and safely. And so the vendors just kind of help us pick, and it had to be in stock. So we had to buy it from in town just because timing, but also the vendors were able to fix them. Like up in the north, sometimes we don't have as much access to multiple different bikes or even mechanics to fix certain ones. So we chose those based on people's ability to use them, of all staff, and then the bike shops. Yeah, makes sense.
Thank you, Joel. So this one's for Katie. Jill was wondering if you could explain what type of insurance you needed to get for the bikes.
Yeah, so our insurance, as long as we were able to provide all of our pilot, elders, and companions waiver and liability forms, it's just to go on record with our insurance. So we didn't have to pay an additional fee. So it would just be your typical insurance that your home already has.
Go ahead, Jane.
Yeah, pardon me. So yeah, for a lot of the care homes, it will already be just an extension of what they have. It's just more notifying them that they're going to run the program. For some of our individual chapters, within across Canada, excluding Quebec, there is a couple different insurance companies where we have a partnership. One is Oasis, and they've been really good at providing insurance, because a lot of other companies won't provide insurance and ask a lot of questions, and it can become a barrier. So we do have a list of partners that we work with, and the insurance comes in around between $2,000 to $3,000, depending on the number of bikes, where you are, and a number of different things. But what we find is a lot of our community groups will partner with other groups that already have insurance for different events. So.
Great. Thank you, Jane. That is something important, that people need to think about when integrating these devices into their facilities. So thank you. So this one's for Jane. So in regards to the map that you had in your slides where it showed the different programs across Canada, Kelly was wondering why there's a much lower enrollment in BC comparative to Ontario, 22, I think it was, versus 45, when BC, seems like a place where you could bike more year round, I guess, than most places in Ontario. So wondering.
Yeah, my apologies. Last minute, I went from a Canva presentation to a PowerPoint presentation because they put the notes on the opposite side. And I didn't catch that it had changed those numbers. So BC actually has 22 locations. It's very vibrant. And in fact, our Vancouver alone chapter has, I believe they're up to 5 bikes now, and the North Shore has 3. So yeah, there is 22 in BC, 27 in Alberta, 7 in Saskatchewan. Yeah. So I think there was a formatting problem there.
For sure. And Kelly did realize that afterwards. She was still curious because why do you think Ontario still has the highest numbers comparatively across Canada? Do you think there's any reason, or maybe it just came there first kind of thing and now we're seeing a pickup?
A great question. I think we've got a strong ambassador in Ottawa who started in 2016 and has worked really hard at doing a lot of great advocacy work there. We've got some, and as you move kind of south, we also, our Brockville, Hamilton chapters are also really strong and really active beyond their local chapter. They're really doing a lot to promote and show off the bike and educate others. Yeah. And it's just bigger.
That's also fair, yeah. Kelly did have one other question here and was wondering if some of the bikes had GPS tracking or anything like that for elders who are taking them out on their own and things like that in case, they maybe have dementia. And so just a way to maybe track them to, make sure they're safe. So she's wondering if that's
Yeah, I do believe that some of the newer models may have some of that built in. To be honest, it's not a big focus for us. What we do make sure is that the pilots all have cell phones and, can certainly, and there's call out procedures should anything happen. So because they're in our bikes and they are with, a person of care, it hasn't been a huge requirement of ours to date.
Thank you.
Not to mention, most of them have a device on that is already tracking them. So.
Great. So there was a question right at the start of the webinar, kind of in regards to safety and citing the Toronto subway incident, which I think quite a number of people might know about. There was a electric bike that caught fire in the subway. And I think it is really important for us to have these conversations around safety when we're talking about battery powered micromobility. And, looking at one of the articles from that incident in particular, the Toronto Fire Services Deputy Chief, he had said there's typically 3 typical causes of these fires, whether it's thermal, so they've overheated, electrical, where they've been overcharged or charged with substandard equipment, or there's physical damage to the batteries and certain failures. And he did say the devices that are manufactured correctly and maintained correctly, they are not seeing this problem of them catching fires and exploded. So that's why I do think it's important, again, for us to have conversations around proper maintenance and safety. So I would like to ask each of you to maybe just talk about certain precautions and practices that you've instilled to, ensure proper maintenance of these devices to ensure personal safety and, safety of the riders. So Joel, I'll let you go first to talk on that.
Yeah, I think that's a great point. We are kind of trialing it. So when we first got the e-bikes, that was a question that came forward about how do we manage that. So basically, we store our bikes in a location where they are monitored just in case. So like there is staff members that are close by, and when someone gets back from a ride, they actually remove the battery and put it at the charging location and charge it. And then if there's extended periods where we're away, we would disconnect the batteries. But we kind of did want to monitor to see if they were heating up or if there was kind of concerns that we could see on a day-to-day basis with the current process that we put in place. And we haven't seen anything to change our practice. We are potentially getting kind of battery boxes that if, for example, the battery did catch fire, it would be in a fire safe box. We haven't implemented that yet. We were kind of seeing how what the risks were or what we saw moving forward. So hopefully that answers your question to a certain extent.
Yeah, that's great, Joel. I think something to keep in mind too is this industry, it is new. We're still learning, and it's important for us, like I said, to have these conversations and to learn from each other and see, okay, what are the opportunities to enhance safety and just make sure that we're monitoring these things correctly. So it's great to hear that you guys have a process for that. Katie, would you like to speak on that as well?
Sure. So our bikes do go for an annual maintenance inspection, as well as when bike season is in, our batteries are charged upstairs in the life enrichment office so that we're always, we can keep an eye on them, we can monitor them. And same as Joel's mentioned, that our batteries are put on our bike when we ride, and then we disconnect them after and plug them back in to be charged. And then off season, our batteries are monitored by our maintenance team downstairs in their workshop.
So thank you, Katie.
Okay.
And Jane, do you have any advice as well?
Yeah, I think, you know, as mentioned, from a bike safety perspective, having regular maintenance and a maintenance schedule, we always encourage and inspire people to have that in place. We also have a checklist that we encourage people to do before they go out. So just checking the bike to make sure that, you know, tires are filled, you know, everything's kind of in place and working properly, test the brakes, test those things. And then also while they're out, if they notice anything, so a way to mechanism to track and record if they noticed anything while they were out, so that we can do a little bit more preventative maintenance. The biggest challenge that we have actually with our trishaws is tires and making sure that they're inflated properly and that people are very cognizant of, you know, potholes, bumps, those kind of things, and need to go very slow over it. It's a lot of weight to come down on those tires. So we do a lot of work and I have a lot of conversations about maneuvering of the bike over those kind of situations. And lastly, on the batteries, you know, we always inspire people to make sure that they have some kind of device that will do an automatic shut off, so they're not being overcharged. And that's an easy, you know, fairly inexpensive piece of equipment that you can buy to just help with the longevity of your batteries.
So thank you, Jane. That's super helpful. I think it's important, you know, something that we've really found out from our research is there's some instances of these fires and different things happening is from people buying super cheap batteries off Amazon and not getting the correct um, batteries for their devices and just not being cognizant and aware of how, you know, these devices are connecting with each other and taking proper care of them. So it's important for us to all reiterate how important safety is in taking care of these devices. Um, so Michael from the Canadian Electric Bike Association, he did put a great link in the chat here for best practices for usage and storage of lithium batteries. We are also, the coalition is going to be putting on another webinar next month where we are going to be talking more about battery-powered micromobility devices, in particular, safety and opportunities for the future. So everybody please stay tuned for that. We're really excited about that one. So it's 10 o'clock. I think it's time to wrap up. We don't have any more questions, it looks like. So I just want to thank all of our attendees for being here today and to all of our speakers, again, for being here to present and answer everyone's questions. We do have a post-webinar feedback survey, which I would really appreciate if all of our attendees took 2 minutes after this to fill out for us. I just added the link in the chat. I will be sending the webinar recording around to all registrants, along with that link as well if you miss it right now. And thank you again, everyone. I hope you enjoy the rest of your day.